Hi and good morning, everyone. My name is Jasmine Kaur. I am a freshman at Georgia State University majoring in biomedical sciences. It's nice to meet everyone. And my research focuses on the effectiveness of computer algorithms when evaluating hidradenitis suppurativa patients, or HS, and Crohn's disease patients, or CD. An association between hidradenitis suppurativa and Crohn's disease has long been suspected with studies done previously, but never validated. My study aimed to investigate and expand on the possibility that certain computer algorithms can identify a similar pathogenic mechanism that contributes to both diseases that will allow healthcare professionals to evaluate HS patients that have CD symptoms early on, saving treatment time and resources in the healthcare industry. Both dermatologists and gastroenterologists were contacted through social media to conduct interviews and gain more background information on the diseases and common cases that they see on a daily basis. And the most common methods of contact were Instagram and Facebook. A successful interview was conducted with a dermatologist that specializes in HS patients and sees them on a daily basis, and I contacted her through Instagram. Additional data on HS and CD patients were collected from two online databases, which were Figshare and clinicaltrials.gov. The experimental procedure was conducted through R programming software, more specifically RStudio. Both datasets were first formatted through Microsoft Excel and then uploaded to RStudio for further analysis. And my dataset A represents HS patients, reflective of the Australian population. And like I mentioned before, I got this dataset from Figshare.com. Dataset B represents CD patients, reflective of the Argentinian population, and I got that dataset from clinicaltrials.gov. To measure differences between patients with suspected HS, no HS, and CD patients, I performed two chi-square tests through RStudio, and both of my chi-square tests for both datasets produced a p-value of less than 2.2 e-16, which is less than the cutoff of 0.05, which would make my results statistically significant. As it can be seen on my poster, my alternative hypothesis stated that there is a relationship between patients with HS and Crohn's disease, and like I said before, my p-value is less than 2.2 e-16, which makes my results statistically significant between the two groups of patients. And if you see here, it shows my values that I used in RStudio. So X, the values for X represents my values for dataset A for different variables, and my dataset for Y represents dataset B, the different values that I use. And the variables for both datasets, as you can see on my poster, the variables measured in both datasets include gender, age, country of birth, smoking history, and these are the independent variables, while the classification of patient groups, suspected HS, no HS, or CD patients were dependent variables. And if you look here at Figure A is a scatter plot of the CD patients group, and Figure A represents the relationship between various variables, like I just mentioned, the different variables, characteristics of patients with Crohn's disease, and Figure B, which is for suspected HS patients group, it represents the relationship between various variables, like I just mentioned before, of patients suspected to have HS. And this box plot represents patient with HS versus CD. So the box plot on the left represents patients suspected to have HS, and the box plot on the right represents CD patients. And because of the limitations of the RStudio, I couldn't combine the two scatter plots. And Figure D represents the distribution of variables in both patients with suspected HS and patients with CD. This is a density graph. And as you can see here, the sample size for both groups were the same, it was 21. And this is the bandwidth for both groups. And as you can see at the density graph, if I zoom in, there's an even distribution on both sides, which can potentially indicate that both groups have similar characteristics, like the different variables that were measured in both groups, which were the same variables that were measured in both groups, had a relationship. And in conclusion, there is sufficient evidence supporting the hypothesis that there is a relationship between HS and CD patients. Therefore, it is concluded that although there is a relationship between HS and CD patients, further research and steps need to be taken to include underserved populations in order to affect the overall population. Without including underserved and misdiagnosed patients, the overall patient demographics are not accurate. And thank you so much for listening to my presentation.